Is the slide full screen now?
No, ma'am.
So what about now?
Yes, ma'am.
Yes, full screen.
So this is Ramisha. I see Ramisha. Okay.
Yes.
Well, we started speaking about pediatricians, and now we are going to read the article. It's My Job, Dr. Nasreen Ahmed. So she's also a pediatrician, and let us read what she says about herself. Let us start with Asna. Is Asna
Yes,
here?
ma'am. Yes, ma'am. My name is Dr. Ma'am. Can I read this?
Yes, yes.
My name is Dr. Nasreen Ahmad, and I work as a pediatrician in Central Auckland, New Zealand Hospital. I have always enjoyed working with young children and the patients. One of the main factors that led me to consider specializing in this field was my own experience of bringing up to my two young children. The understanding this have given me has helped me to empathize more with the parents when they become very anxious.
Okay, thank you. So you can see there is information, some personal information, some personal details about Dr. Ahmed, about her children and her experience working with patients. And if we move to the next slide, we can see then another part of the story. And now let us listen to Shamisha.
Yes, ma'am. Bringing up my own children has made me acutely aware of the parental fear of potential threats throughout childhood, from infant diseases, illnesses like infectious parotitis, varicella, morbilli, rubella, pertussis, acute laryngotracheobronchitis, uh, rubella, meningitis, poliomyelitis, and tetanus. And then there is the parents. Apprehension associated with vaccination like MMR. If I were not a doctor myself, I would probably feel as concerned and fretful about my own children as many of the parents I see who want to discuss combined vaccination for their children.
So you're very good at reading these the names of the illnesses, especially this long one. And do we remember what MMR means? What kind of vaccine is it?
Yes, ma'am.
What is it?
Measles, rubella, mumps. Measles, mumps, rubella. For 3 kinds of
I
disease.
see. Good. Good. So we understand everything, right? So there are some sentences here and which are false, and let us make them true. I mean, we should change one sentence in one word in each sentence to make them true. So now, Ramisha, is Ramisha here? Still absent. John Parvin.
Yes, ma'am.
So read the first sentence, please.
Dr. Ahmad has never enjoyed working
Yes,
with
ma'am.
children.
Yes, ma'am.
Yes.
No, ma'am, I am absent.
Ramisha, I see, but I see now. Yes, John Farvin.
Yes, ma'am. Dr. Ahmad has never enjoyed working with young children and their parents.
So what should we just change here? Which word?
Never.
Never. So we should change into what? Let us say always, right?
Always. He always enjoyed working with young children and their parents.
Okay. Yes, Ramisha. Can you hear me?
Yes, ma'am.
Oh, please read the second sentence.
Dr. Ahmed has no children of her own.
Mhm.
Dr. Ahmed has children of her own.
How many?
2 young children.
2 children, 2 young children of her own. Good. Hala Malik, please, the next sentence.
Yes, ma'am. The experience of raising her own children means Dr. Ahmed is fairly conscious of the fears faced by the parents throughout their children's childhood. Instead of fairly, acutely.
Acutely conscious. Good. Sultan, please.
Yes, ma'am. All of the parents, Dr. Ahmed deals with are anxious about vaccination.
So you are reading
Without-
sentence 5, yes? So what should we change in this sentence to make it closer to what was said in the text?
Without anxious.
Hmm?
Without anxious about vaccination.
Anxious. So she says
Without
that I can't hear you.
without anxious about the vaccinations.
So are all the parents anxious, or what does she say? So here we have many of the parents. I see. Yes. So it's we can change all into many of the parents. Okay, and Sinju, sentence 4, please. It's for you.
Yes, ma'am. Dr. Ahmed feels that being a doctor possibly makes her less worried about vaccination for her own children. Sentence is actually true, and the doctor said that if she was a doctor herself, she would probably feel less concerned and fret
Yes.
about
Yes, instead of possibly, just it's better to use probably. Okay, and if we move to the next slide.
Unit 7.
So here is the listening task. Here, Dr. Ahmed is talking about herself. Let's look through the questions. So, what is she going to tell us about if we look at the questions? Yes? Can we guess, just looking at the questions, what we are going to listen about? So what is she going to tell us about? Do we understand?
she is suffering from some diseases, I guess, because some weakness, because everything he described here as doctor is talking to her and she's telling about her weakness. I think she has some weak point in her consultation, maybe some weak point where she couldn't expose herself to others. She is trying to reveal that now.
Okay.
And she's looking whether she has overcome that weakness or she's still being entangled with that weakness.
Okay, so let us check now. I'll start the recording and you'll tell me if you can hear.
Unit 7, Listening 1.
Can you hear?
Yes, ma'am, we can hear.
Mhm.
Unit 7, Listening 1.
This brings me to an aspect of the training and job application process in New Zealand, which I initially found alien to my cultural background. Talking about oneself, especially about strengths and weaknesses. A weakness I used to have was over-empathizing with the parents and becoming upset when something went wrong with one of the children. In the recent interview for my present post, I related a case where a child almost didn't recover from an attack of meningitis, and I became very upset, even in the presence of the mother. I mentioned how I recorded both the good and bad experiences as part of my daily reflection, and how I talked to colleagues afterwards and soon realized that they had faced the same problems. I now see recording and analyzing my weaknesses in a more positive light as a means for self-education and advancement.
Mhm. Do we need to listen for the second time?
Yes, ma'am.
Mhm.
Unit 7, Listening 1.
This brings me to an aspect of the training and job application process in New Zealand, which I initially found alien to my cultural background. Talking about oneself, especially about strengths and weaknesses. A weakness I used to have was over-empathizing with the parents and becoming upset when something went wrong with one of the children. In the recent interview for my present post, I related a case where a child almost didn't recover from an attack of meningitis, and I became very upset, even in the presence of the mother. I mentioned how I recorded both the good and bad experiences as part of my daily reflection, and how I talked to colleagues afterwards and soon realized that they had faced the same problems. I now see recording and analyzing my weaknesses in a more positive light as a means for self-education and advancement.
Mhm. Okay, so let us just listen to Danish. The first question is for you.
Yes, ma'am. Why was it difficult for Dr. Ahmed to talk about herself? It's because she's currently working in New Zealand, and she found that it is found alien to her cultural background.
Mhm, mhm. Okay, so it was a new environment, a new country. Okay. Well, Ashwati, please, the second question.
Yes, ma'am. What does she describe as a weakness in herself? According to her, weaknesses like emphasizing with the parents and becoming upset when something went wrong with one of the children.
Okay. Well, so Taib, the next question.
Yes, ma'am. Does she have weakness now? She now sees her weakness in a more positive light as a means of that is self-education and advancement.
Yes, she says I used to have this weakness, so it means that now she doesn't have it. Okay, so Labib, is Labib here? No. Hepzibah, please.
Yes, ma'am. What example does she use to explain her weakness? Describe how and when she used the example. She said that she once going for an interview, she saw that a patient who has come across a child who didn't recover from a meningitis attack. So and she was very upset even when there was a mother with them. So this was she said that this was a bad experience. for her. She had told about both the good and bad experience of her.
Good. So, Ansila, the next question, please.
What does she now feel about recording and analyzing her weakness? She's now taking it as a positive light, she's now taking it as self-education and an advancement.
Okay, yes, good. Well, and
Unit 7.
so Dr. Ahmed mentions how she recorded both the good and bad experiences as part of her daily reflection. What do you understand by reflection? What does it mean, reflection, here in this situation? Who can answer this question?
Maybe reflecting on her own mistakes, like looking over into herself, what she have done in the past and how have she overcome that. Self examination, maybe about her character, about her weakness.
So anything else?
Exposure, ma'am.
Yes, sorry.
Exposure.
Okay, some kind of analysis
Experience, ma'am.
Yes, of her experience. Good. And the question, have you been asked to keep a record of your learning experiences, you personally? Have you ever been asked to keep a record of your learning experiences, or maybe of your good and bad experiences, and about your strengths and weaknesses? Have you ever done this?
Yes, ma'am.
So in which situation? What was the situation?
Once when I was studying in school, there was a counseling session for all the students who are appearing for the 12th public examination. So in that time, the person who came there asked us to write all those things which we felt as good and bad about us. And actually, he said us to analyze ourselves at that moment.
And how did you feel? Was it easy?
Actually, it wasn't that easy. It was a bit tough that it was our first time to do so. So we thought actually it will be easy, but reflecting on ourselves or finding the good and bad within ourselves took us some time. And after writing down it, we could find that there are something that I should change within myself.
So it was useful anyway, right?
Yes, ma'am.
And what about other students? Have you ever had such experience? Or do you analyze it for yourself, just you reflect about strengths and weaknesses? Okay, so and what about your culture? Would this be acceptable, for example, in your culture, or do you think it's acceptable in all cultures? Yes, guys?
It may not be acceptable in all cultures, ma'am. We know that the cultures from place to place is different. For example, if we take India, in India itself, we have a large number of cultures that person to person it may differ, or from family to family. Some are very open so that they can find their own good and bad things and they can write it down or they can share it with others. But some of them may be introvert and they keep it to themselves and they really don't open up very well. So it depends on and the culture in which they have grown up.
The culture in the family, right?
Yes, ma'am.
Okay, good. So so we've discussed this. Now let us focus on some names of diseases, and here is we're going to speak about non-technical language, which is used by common people to speak about diseases. So there are some new words just to focus on to be able to understand the information. Just come out in become covered with a rash, for example, come out in rash. So German measles. So German comes from German, in other words, closely related to. Then jab, vaccination, injection. So up means here swollen. Scrap, the scrap here is in the picture, to form a crust or just a scab on a wound or a sore. Runny nose, coryza, you know this, and stridor, an inspiratory sound which is due to partial obstruction of the upper airways. Stridor. Now, so let us focus on the names of the diseases. So you see that there are some non-technical words, terms for the names of infant diseases. So chickenpox, what does it mean? What is the medical equivalent to chickenpox? Sorry?
Varicella.
Varicella, okay. So please, just 3 minutes for you to write the medical terms next to their non-technical names. So the names of the diseases. Write them down, please. Well, so let us read what we've written. So, and let us listen to Sinju, please. Sinju?
Yes, ma'am. Can you hear me?
Yes.
For chickenpox, it is variola.
Varicella.
Varicella, sorry, varicella. And for German measles, it is rubella. For whooping cough, it is pertussis.
Okay.
And for mumps.
Mumps. So inflammation of some glands.
It is parotitis.
Yes, infectious parotitis.
For measles, it is rubiola.
Okay.
For sixth one,
this is a very long word that we've met in the text about Dr. Ahmed.
It is laryngotracheobronchitis.
Exactly, yes. The word that I can't pronounce. Okay.
Lockjaw, it is tetanus.
Tetanus. Good. Perfect. Thank you. Well, and so let us use the non-technical words to complete this sentence, non-technical words. So if we look at the first sentence, let us just listen to Asna. So read the situation, please.
Ma'am, first, ma'am, if he had epiglottis, he would have to stutter all the time and not just when he upset. So I think it is. Ma'am, can you hear me?
No, I mean that you should choose from the words on this slide.
Yes, ma'am.
So, which word should we choose here?
It would be.
You can help us.
One minute, ma'am. Stop, ma'am.
Does anyone have an idea which disease is it?
Ma'am,
yes. Yes, this is
group.
Okay, thank you. Now let us look at the other sentences and analyze the situations and write the non-technical word in each gap here. So just 3 minutes for you. Start, please. Well, let us read the sentences. Shamisha, please. Shamisha?
Hello, ma'am.
The second sentence, please.
The glands behind his ear up, but there are usually no complications with, I think, mumps.
Yes, you're right, mums. Ramisha is absent.
Yes, ma'am. Yes,
You
ma'am.
are here. Yes.
If you have just vaccinated for German, you will need to avoid getting pregnant for next 6 months.
Okay. Yes, German measles. Yes, it's dangerous. Well, John Farvin.
Yes, ma'am. If he had dash, he hadn't have several symptoms like conjunctivitis, cough, and running nose. I think it just a viral rash he had got. It is measles.
Measles. Measles. Okay. The next is Hala Malik.
Yes, ma'am. If he had all his jabs, then he will protected against dash even if he broke the skin with dirty needle. Ma'am, lockjaw, tetanus.
Yes, you're right.
Lockjaw.
Well, Sultan, please.
Yes, ma'am. I think he got dash, doctor. He had fever, and then he came up in spots on his body, inflamed, and then they started to scab. It's chicken pox, ma'am.
Yes, chicken pox. And Sinju.
Yes, ma'am. If he had dash, wouldn't he have a strong breathing in sound and coughing fits with vomiting? Whooping cough.
Whooping cough. Okay. Well, and so are the childhood illnesses listed above common in your country? And what other diseases are common?
This type of diseases are common in our country, ma'am. Other diseases are common cold.
Whooping coughs and mumps are most common in our countries, and other some rubella. For rubella, we are taking vaccination for each time.
Ma'am, also we can say that some are seasonal. Ma'am. In rainy seasons, most of the people will have chicken pox and all. Also the measles, whooping cough and all are seen in rainy seasons. When it's summer, some other kind of diseases are seen. So we can say that it's seasonal, and also we can say it is seasonal because the mode of transmission also depends on season, ma'am. Summer, in case of whooping cough, it get transmitted by the air. No? So in the case of summer, it can easily spread through air. But in chicken pox and all, it is passed through vectors. The vectors are mosquitoes, and so sorry, ma'am. Chicken pox and all are transmitted through air. So when it is yes. Yeah, ma'am.
Okay, thank you. So, and so there are some information about science and some situation, and we don't a baby, a little child can't say himself about his conditions or what he or she feels, and so we can judge by mother's statements how the child behaves. Can we think of the symptoms that a mother describes? For example, she said that he keeps touching his head. What does it mean?
Headache.
Headache. So what about the second situation? He's been shying away from bright lights.
Eye problems.
Eye problems. Photophobia, right? Or it can be, yes, it can be a sign of meningitis, right? Also. He can't move his head very much.
Stiff neck.
Neck stiffness.
Neck stiffness. He's not himself at all. I've never seen him like this before.
Mood swings.
Yes, so some abnormal, just mood. He's been running a high temperature.
Fever, body temperature, fever.
Fever. He's come out in a rash around his middle.
Maybe allergy.
Sorry?
Allergies.
Allergy, yes, possible. He's been making odd crying noises.
Mood swings again.
A lot of things.
Unwell.
And he's been making these odd movements. It can be seizure, right? So,
yes, ma'am.
Well, I would like you to focus on the home assignment. It's on the Moodle site. So this is about making video about your strengths and weaknesses. So you should write about your strengths, your personal strengths and weaknesses. If you say it's okay in your culture, you can start with I feel that I am. And about the technical just side of this, you should make a 2-minute video record of your story. I mean, you first write it, you memorize, and you say, you tell the story about your strengths and weaknesses, maybe about your some more personal information about your name and just something else. And you should so say the story looking at the camera, and then you should upload the video to your YouTube channel and give the link on the Moodle site. So do you have you ever had the experience of working with the YouTube channel?
Yes, we have done it once for anatomy. I used to.
Is it your personal YouTube channel?
It's for our group, ma'am, like GM2101. We did it for a group.
And is it okay if I ask you to make up your own channel? Can you do this?
Yes, ma'am, we can.
So try to do this. So and just make this video, and I'll just eager to see how you speak and see your faces. Well, that is one of the tasks, and so another task, yes, will be connected with vocabulary, and it's also on the Moodle site.